Hey, I'm Dr. Wright. I'm going to be talking to you guys today about Achilles tendonitis, tendinopathy. It's a specific injury to the Achilles tendon, which kind of runs down from the hamstring down to your heel. Specifically, I wanted to talk about how it can relate to athletes and sports in general. What Achilles tendinopathy is it's typically you see it a lot in runners, high explosive type athletes, sprinters, even linemen in a football game exploding off the line, that kind of situation. And it's like an overuse injury that results from repetitive strain to the Achilles tendon. It causes pain. You can see a patient walking in with a limp, inflammation, sometimes redness, swelling around the area. It can be a tough one to treat. Typically, initially, what you want to do with it is rest, ice, elevate it. Your typical RICE kind of treatment plan that you would do for a lot of these sprain strain type situations. In the office, a big thing that we like to do with it is actually the shockwave machine, which I know we've talked about before. I've had a lot of shockwave patients that we've been working through the Achilles tendonitis with, and they do really great with that type of treatment. On top of that, once you get pain and inflammation under control, then what you would like to do then is focus on the rehab with it. And specifically for the Achilles tendon, one of the best exercises that you can do is an eccentric loading exercise. And what that means is you're controlling the lengthening of the tendon, and that really is the gold standard. So I like to run through my patients with a lot of rehab through the eccentric loading protocols with that, and we get great results in the office. On top of the shockwave therapy, a lot of other things that we do in the office for this focuses on lower extremity mobility, general lower extremity range of motion type things, ankle mobilizations, hip, knee, low back, pelvis, all of that plays into it. You want everything to be moving correctly, which then allows that Achilles tendon and your gastrocnemius, your calf muscle, your hamstrings to function properly. That's going to put someone in the best position to help rehab this type of injury. We do a lot of hamstring stretches, calf stretches, that kind of situation. Massage as well. Getting in with one of the massage therapists, that has been very helpful for this type of injury. So it's great that we have all of that under one roof, and we're really set up perfectly to kind of deal with this all in the office. There are situations where a referral may be warranted if we're worried that there is a rupture, it's not responding to care, that kind of thing. Then definitely getting in with an orthopedist, doing an MRI, that kind of thing, to make sure there's nothing more severe going on that would possibly even require surgical intervention. That's something that we're well equipped to handle as well.